campaign, and I'm really proud to be here doing that. I'm just a small cog. Lots of people have done lots more than me, but like I say, I'm very proud to have been asked to say something. First, I just wanted to say why I got involved. I've been a patient at Slawit since I first came to the Colne Valley in 1988, and my experience of the surgery for me and my family has been positive, brilliant over the years. I think I took it for granted, and then I started hearing my friends say things like, I had to queue outside the surgery this morning to get an appointment because my back's so bad, I really needed to see somebody that day. This is somebody who could barely walk, let alone stand and queue to get an appointment at the surgery. So I knew our surgery was worth fighting for. So I attended that patient participation group meeting. I think it was my first. I don't think there's been one like it since, but I thought we were always going to be this exciting, a bit doom-laden, but and like Paul said, Fiona was there, and from that meeting it told us about the plans, the cuts that were coming, and we were all absolutely dismayed that they really, like Thelma said and others have said, put their necks on the line to tell us. Imagine they hadn't been allowed to tell us as patients what was being planned, and you know, they stood up, and I think we felt, well, we have to stand with them, and we had our first public meeting in the church. We've been all over Slawit, haven't we? In the church, and from that the campaign really was born. Fiona and I went to see Jason McCartney on a very cold December day in 2015, you know, expecting a little bit of Christmas cheer. I've been seen before and it was quite charming, but absolutely dismissive and not supportive from day one, really. And I think somebody mentioned when we lobbied his surgery in Marsden as well, absolutely dismissive. So he, and calling us bleating activists in Parliament, so quite derogatory about us. But we have had fantastic support from Councillor Rob Walker and Councillor Nicola Turner and Thelma before she was an MP, and really glad she's here supporting us as our MP. So the campaign has been fantastic. We've done lots, and I just want to refer to my notes because I don't want to forget things. We've leafleted in the snow. We've had a fundraiser in the rain. Although it was a fantastic party, so the rain didn't matter too much. We had a patients' parade and eating cake in the sun. So cake, we do cake well. Yes, and there's probably loads still out there. And we've been on lots of marches and demos alongside other health campaigners. And who can forget that fantastic turnout in the surgery when we were, and I never quite got this, I'll be honest, when we were to knit our own GP.
Oh, yeah.
We were doing our own consultation, as Paul says. But that Saturday morning in the surgery, so many people came. We expected it to last about an hour. Nobody wanted to go. And that really buoyed us up from the start, really, that the surgery meant so much to so many people. And people were writing down what the surgery meant. It was absolutely fantastic. And of course, out of that morning, came our own song. So we had our own song, we have our own banner, I think it's there, it's on lots of those photos. Of course we have the obligatory Facebook page. We have our own picture frame being modelled by Fiona there. And finally, a bit of a plug, we have our own mugs. There's still so you can buy them if you haven't already got them. I'm sure they'll become a collector's item. We've been really creative, and I think Paula said about the publicity and getting national radio, television, local radio and television, the examiner coverage. So many people know about this campaign. It's absolutely amazing. When the CCG announced in January last year about the cuts to the HRI that we've been talking about, you know, for us who was in this campaign, it didn't make sense. They were cutting the surgeries that were going to provide this care closer to home, and then to provide the cuts to the hospital. It just absolutely didn't make sense. But we, as a campaign, took the decision then that we would work with other health campaigns, and particularly the ANZAF HRI campaign and the Upper Combe Valley group of that campaign. And I've been asked on their behalf to send their congratulations to us. Some of us do wear two hats, so I'm congratulating myself as well. But, you know, the support and the mutual support has been really good, and we've energised each other, I think. So the fundraising, as been mentioned, was to partly fund a legal case that one of the patients was going to take. And so we've worked in different ways and in imaginative ways. We've worked alongside the doctors where we could. We've been in the campaign, getting all the publicity that we can, but also behind the scenes developing, some people work really hard on developing the legal case. So we have done a lot, and it's really good to get to this point that, you know, we have won. I don't want to end on a downer, but I think people have said we just have to be vigilant, don't we? This is, you know, this funding is from the same CCG that told us about 120 beds at the beginning of 2016 for HRI, which wasn't acceptable, but now it's 64. So, you know, we do have to be vigilant and probably in some way keep the campaign going. But anyway, thank you for listening to me.